Breaking the Silence, a revolution in black health. Welcome to the BlackCEO Podcast, where we dive deep into the issues that matter most to our community. Today, we're in for a treat, a conversation that will challenge, inspire, and quite possibly change lives. We're exploring a topic that's been shrouded in silence for far too long, cancer in the black community, and who better to guide us through this critical discussion than the extraordinary Garrina Ross. Now, before we dive in, let me tell you a bit about Garrina. This woman is nothing short of a force of nature. She's not just an advocate, she's a warrior on the front lines of health equity. Her tireless efforts to empower our community in the face of cancer have sparked a movement that's spreading like wildfire. Garrina doesn't just talk the talk, she walks the walk, and she's leaving footprints that are reshaping the landscape of black healthcare. Her impact? Well, let's just say that future generations will look back and thank her for the battle she's fighting today. So buckle up, folks. We're about to embark on a journey that might make you uncomfortable, might make you angry, but will ultimately leave you feeling inspired and ready to take action, because that's what Garrina does. She lights fires in the souls of those who listen. Let's start with a question that might make you squirm a little. When was the last time you talked about cancer with your family? And I don't mean in hushed tones or vague references. I'm talking about a real, honest-to-goodness conversation about risk factors, screenings, and prevention. If you're drawing a blank, don't worry, you're not alone. In fact, you're part of a silent majority in our community, a majority that's been conditioned to keep quiet about health issues, especially something as terrifying as cancer. But here's the kicker. Our silence is killing us, literally. Now, I can almost hear some of you thinking, come on, it can't be that bad. But let me hit you with some cold, hard facts. Black women have a 40% higher death rate from breast cancer compared to white women. Let that sink in for a moment. 40%. That's not a small difference. That's not a rounding error. That's a crisis. But here's the thing. Cancer doesn't discriminate based on skin color. These disparities aren't because of some genetic predisposition. No, they're the result of a complex web of factors: delayed diagnoses, limited access to quality care, and yes, our own silence and fear. So what do we do? How do we break this cycle of silence and fear? Well, that's where organizations like Sisters Network, Inc. come in. Picture this. A group of warrior women, all survivors of breast cancer, coming together to create a support system like no other. These women aren't just offering a shoulder to cry on, though that's important too. They're arming other women with knowledge, connecting them to resources, and shouting from the rooftops about the importance of early detection. Let me tell you a story about a woman named Tasha. Tasha found a lump in her breast, but was too scared to get it checked out. She'd heard horror stories about cancer treatments and thought ignorance was bliss. But then she attended a Sisters Network, Inc. event. There, surrounded by survivors who looked like her, who understood her fears, Tasha found the courage to seek help. Today, she's not just a survivor, she's an advocate, sharing her story and encouraging other women to prioritize their health. This is the power of community support. It's not just about providing information, it's about creating a safe space where fears can be voiced, questions can be asked, and hope can flourish. And let me tell you, the impact is real. Sisters Network, Inc. has touched the lives of thousands of women, turning fear into empowerment, silence into action. But here's the thing. Breast cancer is just one piece of the puzzle. The disparities in cancer care for the black community span across various types of cancer. That's where initiatives like Targeting Cancer and Black's TCiB come into play. Now, I know what you're thinking, another acronym, another program. But stick with me, because this one's a game changer. TCiB is like that friend who doesn't just tell you to eat healthier, they show up at your house with groceries and recipes. This program doesn't just throw information at people and hope it sticks. No, they get down in the trenches working with community leaders, healthcare providers, and everyday folks to create culturally sensitive strategies for cancer prevention and early detection. Let me paint you a picture. Imagine a barber shop, the heartbeat of many black communities. Now, picture health educators setting up shop right there, talking to men about prostate cancer screening while they get their fade. That's the kind of innovative grassroots approach TCiB is taking, and guess what? It's working. They've seen significant increase in cancer screening rates among African American adults, but TCiB isn't just about individual health choices. They're shining a spotlight on the systemic issues that contribute to cancer disparities. Things like food deserts that make it hard to maintain a healthy diet, or the lack of green spaces for exercise in many black neighborhoods. By addressing these root causes, TCiB is paving the way for long-term sustainable change. Now, I can almost hear some of you thinking, that's great and all, but what about the big picture? How do we make noise on the national level? Well, buckle up, because that's where the National Black Family Cancer Awareness Week comes in. Imagine a week where social media is flooded with messages about cancer prevention, where community centers are bustling with health fairs, where families are having open, honest conversations about their health histories. That's what this initiative is all about. It's like a megaphone for our community, amplifying our voices and our concerns. But it's not just about making noise. It's about action. This initiative is mobilizing stakeholders from grassroots organizations to national institutions to address the high cancer death rates in the Black community. They're tackling everything from increasing participation in clinical trials to encouraging more diverse specimen donations for research. And let me tell you, the impact is real. I heard about a family in Atlanta who, inspired by this initiative, decided to create a family health tree. They uncovered a history of colon cancer that no one had talked about before. Armed with this knowledge, they're now proactive about screenings and lifestyle changes. That's the power of awareness and open dialogue. But here's the thing, and this is crucial. All of these initiatives, all of this progress, it means nothing if we don't take action, if we don't use our voices, if we don't become advocates for our own health and the health of our community. So what does that look like in practice? It starts with education. Learn about the cancer risks that disproportionately affect our community. Understand the importance of early detection and regular screenings. But don't stop there. Share this knowledge with your family, your friends, your community. Get involved with organizations like Sisters Network, Inc., or initiatives like the National Black Family Cancer Awareness Week. Volunteer, donate if you can, or simply spread the word about their work. And when you see systemic barriers to health care in your community, speak up. Contact your local representatives. Join advocacy groups. Make your voice heard. But perhaps most importantly, take care of yourself and encourage others to do the same. Schedule that checkup you've been putting off. Have those difficult conversations about family health history. Be a role model for health and wellness in your community. Now, I know what some of you might be thinking. This all sounds great, but it's overwhelming. Where do I even start? And I get it. The challenges we face can seem insurmountable. But remember this, every movement, every revolution starts with a single step. Maybe your first step is simply sharing what you've learned today with a friend or family member. Maybe it's scheduling that overdue checkup. Or maybe it's reaching out to a local organization to see how you can get involved. Whatever it is, take that step. Because here's the truth. Your voice matters. Your actions matter. You have the power to make a difference. I want to circle back to something Garrina said that really stuck with me. She said, our community is not just fighting cancer. We're fighting a system that wasn't designed with us in mind. But we're resilient, we're strong. And when we come together, we're unstoppable. Those words hit me like the ton of bricks because it's true. The challenges we face are not just medical, they're societal, they're systemic. But that doesn't mean they're insurmountable. It means we need to approach them from all angles. We need to be advocates, not just for better treatment, but for better prevention, better education, better access to care. And here's the beautiful thing. We're already seeing the impact of this holistic approach. Organizations like Sisters Network, Inc., programs like TCiB, initiatives like the National Black Family Cancer Awareness Week, they're all pieces of a larger puzzle. They're all working toward the same goal, empowering our community to take control of our health. But they can't do it alone. They need us, all of us, to amplify their message, to support their work, to be the change we want to see in our community. So I want to leave you with a challenge. In the next week, take one concrete step towards better health for yourself and for your community. Maybe that's scheduling a checkup. Maybe it's having a conversation with your family about health history. Maybe it's reaching out to a local organization to volunteer. Whatever it is, do it, and then share your experience. Use your voice to inspire others. Because here's the truth. Cancer is a formidable opponent, but it's not invincible. And when we come together as a community, when we raise our voices, when we support each other, when we demand better, we become a force to be reckoned with. Remember, your voice matters. Your story matters. Your health matters. And together, we can write a new chapter in the story of cancer in our community, a chapter of empowerment, of resilience, of hope. So let's break the silence. Let's shatter the stigma. Let's be the change we want to see. Because when it comes to the health of our community, Silence is not an option. Action is not just important, it's essential. This is not just a call to action. It's a rallying cry for a revolution in black health. We've been silent for too long. We've suffered in the shadows for too long. It's time to step into the light, to raise our voices, to demand the care and attention our community deserves. Imagine a world where black women don't have to fear a breast cancer diagnosis because they know they'll receive the same quality of care as anyone else. Imagine a world where our men aren't hesitant to get screened for prostate cancer because they trust the healthcare system. Imagine a world where our children grow up with the knowledge and resources to live long, healthy lives. That world is possible, but it won't happen by itself. It requires each and every one of us to take a stand, to speak up, to act. Whether you're a community leader, a healthcare professional, or just someone who cares about the health of our community, you have a role to play in this revolution. So I challenge you, no, I dare you to be part of this change. Educate yourself about the health disparities affecting our community. Have those difficult conversations with your loved ones about family health history. Get involved with organizations fighting for health equity. And most importantly, take charge of your own health. Because here's the thing, this isn't just about fighting cancer. This is about reclaiming our power. This is about asserting our right to health and well-being. This is about ensuring that future generations of black Americans don't have to face the same disparities we're fighting today. We are strong. We are resilient. We are survivors. And when we come together, there's nothing we can't overcome. So let's join hands, let's raise our voices, and let's create a healthier, stronger future for our community. The revolution in black health starts now. And it starts with you. Are you ready to answer the call? Thank you.